Welcome to page 106 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The coronary arteries and cardiac veins. The blood needs heart. The heart needs blood too. Just like all the muscles, glands, and organs and cells of your body, the heart needs blood to function. Remember, it's a big, massive cardiac muscle, and that muscle needs oxygen to pump. But how does it get that oxygen? How does it get that blood? Well, it does so through the right and left coronary arteries. Starting with the right coronary artery, coming off of the aortic arch. Recall that the left ventricle is squeezing. This left ventricle here is squeezing its blood into the aortic arch and out to the body. And some of that blood comes through these coronary arteries. So branching off of the aorta is the right coronary artery with its muscular branch. And what is called its marginal branch. Along the right ventricle there. And it continues to wrap around into the posterior interventricular or descending branch. So it will have branches coming off of it like so, and then wind up with this descending branch here on the back side of the heart. The left coronary artery, let's make it a lighter purple there. The left coronary artery comes off and bifurcates into the anterior interventricular or descending branch. And the circumflex branch. Going around, circling around the backside, certainly giving off arterioles on the backside too. And the anterior interventricular branched off, by the way, into these muscular branches here, by the way. And that is how the heart itself receives freshly oxygenated blood from the descending aorta here. How does the blood return to the heart? Well, it does so in a very similar way. These veins, the cardiac veins, often follow a similar path to the coronary arteries. And they drain obviously in the opposite direction. This is deoxygenated blood, and they drain directly into the right atrium. Starting with the anterior cardiac vein. Anterior, of course, meaning on the front of the heart. And the great cardiac vein running around and then around the back of the heart. And draining, most of these veins wind up draining into a structure called the coronary sinus, which is a big sort of fat vein running across the back of the heart, which will eventually drain into the right atrium as well on the back side of the heart. Contributing to the coronary sinus here on the back of the heart is the middle cardiac vein. Of course, the great cardiac vein here wraps around from the front to the back and draining into the coronary sinus. This should be sort of a big vein here on the back side of the heart. Small cardiac vein here on the right side of the heart, wrapping around and then draining eventually also into the coronary sinus. And the marginal vein, tributary to the great cardiac vein. It's not easily shown here on the backside, but this coronary sinus does in fact drain into the right atrium of the heart. Another thing to note here is that you've heard of heart attacks and myocardial infarctions, and they are due to a plaque buildup. A plaque buildup due to platelet or clotting, aggregation of clotting factors. And here is a blow up of what that looks like. They've taken a portion of the coronary artery and they've blown it up, and they've shown this little plaquing right here. You can see how the plaquing narrows the coronary artery here and leaves less space for the blood to travel through. Of course, that can cut off the oxygen supply to the myocardium, and lack of oxygen is called ischemia. This can cause pain, known as angina, in the chest, back, shoulder. And so that's your heart attack, your myocardial infarction. And we all know it can lead to permanent damage of the heart muscle and possibly death. And it's described here, myocardial infarction. This has been page 106 of Anatomy Coloring Book. This is Dr. Stephen Harkins.